time for our weekly visit with Dr. Kevin Kavanagh. Dr. Kavanagh is a retired physician and founder of a national organization called Health Watch USA. Dr. K, good morning, sir.
Good morning, Jack.
We begin our discussion this morning not really about COVID, but about fears of a rise in polio in New York. So what's up?
Well, that's correct. And really, this is like a triple threat. We're dealing with SARS, monkeypox, and now polio. There's been one case of polio, and I'm assuming because they diagnosed it, it was a paralytic case. In other words, someone who was paralyzed. And this was in Rockland County, New York. And this is very disturbing because for every case of paralytic polio, there can be hundreds, 200 to 300 individuals that are passing around the infection. Polio is very much like SARS-CoV-2. It has asymptomatic spread. Approximately 72% of the people are asymptomatic. Another 25% or more have flu-like symptoms, and only about 1 in 200 have a paralytic type of a presentation. Most of those recover. However, between 2 and 10% will go on and die, which is unfortunate, and not very many, but as you know, this disease concentrates often on children, and it has devastating disability. People are not vaccinated to polio to a point where we can expect to get herd immunity. In the counties where this disease had an outbreak, that is in Rockland County and adjacent Orange County, there are only approximately 60% of the people who are vaccinated to polio. Now, that's not nearly enough to get herd immunity, which would take 80 to 86% of the people being vaccinated. In these counties, there is definite fear of community spread. They've had 7 wastewater samples that have been positive for the virus. And so here you have a virus that may be spreading in a community that people do not have their vaccination levels high enough to prevent the spread. And so this is very concerning. And we're concerned that the vaccine hesitancy that we're seeing with SARS-CoV-2 is now spilling over to polio. And as you know, our vaccination rates for SARS-CoV-2 in Kentucky are very low. We're below 60%. The last I checked, we're at 58%, only having the 2-dose vaccine. And that is not very effective for this current variant because you need to get boosted. And our rates of people being boosted are only 27%. And so, Jack, this is worrisome. It's kind of like a triple threat. If people don't follow medical advice and public health advice, we're going to be really no better off than we were in the dark ages. And we're now starting to see these diseases which we thought were gone that don't affect mankind, and that includes monkeypox, it includes polio, starting to reemerge, and in the case of monkeypox, it's still having exponential growth in the United States. That's correct. Monkeypox is spread by close skin-to-skin contact. Now, of course, if you're getting spreading of monkeypox with close skin-to-skin contact, SARS-CoV-2 just loves that type of interaction, and so it will also be spreading. And monkeypox is affecting children. It can be quite a severe disease. And what is really feared with this virus is that it can enter into the rodent population as it has in Africa. It then becomes endemic and you'll never get rid of the disease. And of course, monkeypox is related to smallpox. It is essentially a variant of that virus, and there is a potential for it to mutate. Now, luckily, it is a DNA virus, so its mutation rate is low, but it certainly can mutate to become a much more severe form, is what we had to deal with smallpox. And so right now it's concerning. People need to follow CDC advice. They need to be wearing masking when they're going into indoor settings, avoiding close contact with people who you do not know or who you're not closely related to. Jack, this is something that I can't underscore more because These diseases will not go away by using political sound bites. It's going to take action, and it's going to take support of public health initiatives.
Here's something important. Talk about that Yale study on pre-testing for COVID on the day of an event and the results of that.
Yes, and I think that is very important. Not many people are affording themselves of home testing. And certainly, if you're at high risk, or if you're living with other people or in close contact with people who are at high risk, meaning over the age of 50 or have any number of different medical ailments, pre-testing is an excellent shield to prevent spread of this disease. It's not for sure, but according to a Yale study, if you're having a large event and you pre-test on the day of the event, not 2 to 3 days before, but on the day of the event, they found that you can cut the spread of the virus by about 50%. And believe me, if we could cut the death rate of SARS-CoV-2, which is currently hovering around 500 cases a day, by 50%, that would be significant. And also, if we could cut long COVID, which new research shows is starting to appear in about 12.5% of individuals that have contracted COVID or tested positive for the virus. If we could do that, it would place a huge dent in the amount of disease and disability we're dealing with. So we really do need to come together, start wearing N95 masks. Businesses need to improve indoor ventilation, and we need to get vaccinated. These viruses are not going to go away. They're not going to respond to political sound bites. We need to take decisive action.
We have a new variant.
Well, that's correct. And it's very, very disturbing that these variants are coming on at such a rapid rate. The new variant is BA 4.6. It looks like it's starting to have exponential spread. It's making up approximately 4.1% of the isolates. It looks like it's having exponential growth, and it is effectively outcompeting our current variant, BA.5. It does appear to spread more effectively. We're not sure whether or not it's more or less virulent or whether it's more contagious, but it does appear to be more contagious. And I can tell you, Jack, if it also evades immunity or has another group of individuals that is susceptible to it, we're going to be in for another period of prolonged cases from SARS-CoV-2. And we really do need to decrease the level of virus that we have. This is not sustainable. These viruses are going to keep mutating. They're going to keep attacking us unless we really take decisive action and stop the spread.
All right, not any good news this morning, unfortunately, but it's stuff we need to know about and be aware of for sure. Dr. K, thank you, sir.
Thank you, Jack. I appreciate it.